The last thing you want to worry about, especially as a senior, is where you can go for primary health care. WellMed not only treats health problems, but they can help you avoid some issues too. Dr. Jackie Carruthers with WellMed says when you first walk through the doors, you're a patient, but it won't take long before you feel like a friend. Dr. Carruthers, WellMed got started at a time when medicine became and healthcare became so confusing for a lot of people. And as a result, if it was too hard to get to our doctor, we blew off our physicals, right? And then we showed up to the doctor's office when we were in crisis. One of the things that WellMed wants to do is avoid that crisis.
That's right. It's important to pick up things very early. And we've learned that if we do preventative type care, that we keep people out of the hospital, we keep them healthier, and then we get them to come in frequently. So we do telehealth, I talk to them on the phone, I call for well checks, and we honestly almost form a friendship.
Yeah.
We really do.
Well, if there's anybody you want to be friends with, it's going to be your doctor, okay?
That's right.
Right, okay.
That's right.
Medicare. So many times patients have picked up a phone and called and said, do you take Medicare? Do you take Medicare? Do you take new patients? You do both of that.
I do both. I do both. Medicare is all we do, for the most part. Seniors, I just absolutely love. Years ago, let me tell you a story real quick.
Okay.
Years ago, I built my own office building, 11,000 square foot on Shepherd and 45. Kept it for 12 years, and I found that on the street, you got more people to come in, but the young people would come in and just would be just so disrespectful. You know, just very hard to deal with. Didn't do anything you asked them to do. Seniors came in and they were just very appreciative of the time that you sat and talked with them. So I said, you know, and I think this is what Dr. Rapier, he's the gentleman that established WellMed. And his idea was to get a group of seniors and to look at them in a way that you could prevent something from happening. And you do that by getting an EKG every now and then, maybe once a year. You look at the EKG, you compare that EKG with the previous EKG, see if there's any changes. Yeah. So you're proactive.
Yeah, and this is where the convenience also comes in. We come here, you're kind of the gatekeeper. I won't say gatekeeper, you're kind of
that's what it is.
Yeah, so you're like, okay, let's keep these things at bay. But when somebody does need to go to a specialist, there are times when patients have come in and said, well, they said I need to see a cardiologist. Do you know one? Does anybody know a cardiologist? You're not going to leave somebody hanging.
No. You know, I've been in this community probably 30 years, and I know so many good doctors. But things like diabetes, I'm an internist. Congestive heart failure, end-stage renal disease, you know, that's my bread and butter. That's what I do every day. And we can manage a lot of that. But every now and then they'll have to go to the specialist. And we have very good specialists in line with us that we can easily send them to.
So we have a team of doctors on our side.
We got a team of doctors that take care of our patients here.
The other thing is convenience, 24/7.
24/7. We've got 25 clinics in the Houston area that they've developed actually over a 2-year period. So it's rapidly growing.
Yeah. We have an aging population
Yes,
too,
we do.
right? All right, telemedicine opened up some doors in the world of convenience as well. But as we know, a lot of seniors are like, tele what?
Yeah, absolutely. You know what? That is the one good thing that came from this pandemic, is that telehealth. And it's almost like they're talking to their best friend. These seniors just absolutely love it. We can sit and talk exactly where she is, as long as she needs to talk to get the issues resolved. And that's something I do on a regular basis.
Yeah. Every now and then, someone might need a home visit because they can't get out.
Yeah.
You can make a way to get to them.
WellMed has kind of a concierge service where if the senior cannot get out, we put a team of people together and they go out to the house and take care of all their needs. And we kind of embrace every senior. And every senior is special to us. But it's important to sit quietly, listen to the patient. Most patients will tell you exactly what's wrong with them if you listen. A lot of doctors don't listen. WellMed allows us the time and luxury to sit down and talk to people.
Let me round out with
difference.
this. You've practiced medicine in other ways. What attracted you to WellMed?
Okay, WellMed actually was doing exactly the things that I wanted to do, but I didn't have the resources to do them, like get transportation. like call the patients at home, because it was all about volume. So I turned 54 and I said, listen, I think there's got to be a change. I've got to do something different. I don't have a retirement. I don't have a 401k. I don't have health care.
You're self-employed.
Self-employed. So I've got to do something different. So WellMed actually was a blessing to me.
Because it lets you do your passion.
That's right.
And not worry about the other stuff.
That's right.
Well, I'm going to step away for a second because I have something to say to you, okay?
Okay.
All right, hold on one second. Dr. Carruthers, they say an apple a day keeps the doctor away.
Okay.
But you know what? I want to keep you around. Thank you very much for the way you practice medicine and taking care of everyone, especially our seniors.
Thank you. Thank you for coming.
For more information on WellMed or to become a patient, call the WellMed at St. Edward's location. Here's the number. It's 713-694-6390. Again, that's 713-694-6390, or visit wellmedfindadoctor.com.